healthcare is always going to be inherently political. And then what that's led to is that we start seeing where there's a rejection of good standing health guidance, we are seeing there's rising animosity between groups. So rather than just being strongly associated with mine, I'm strongly against other.
Welcome back to Paul Talk Science, the podcast where we dive deep into the pressing issues shaping health, science, and society today. I'm your host, Paul Adikboji, and I'm thrilled to have you join me for another thought-provoking episode. Today, we are tackling a topic that sits at the crossroads of healthcare, politics, and public trust. A dynamic that has profound impact for all of us, no matter where in the world we live. It's about polarization, not just in politics, but in how we approach our health. Think about this. When faced with a decision about our health, are we basing it on medical advice, or are we letting our group affiliations, ideologies, and biases lead the way? According to my guest today, polarization is no longer just a political phenomenon. It's seeping into healthcare, creating divisions, increasing mistrust, and putting lives at risk. We are seeing communities turning away from science-backed guidance, choosing instead to align with their team or belief system, often at the expense of public health. From the rejection of vaccines to the resurgence of diseases we thought we had conquered, this issue isn't just academic, it's real and it's affecting us all. But here is the twist. Amidst all this division, there is also hope. My guest, Dr. Ruggeri, a professor of health policy and management at Columbia University School of Public Health, shares a powerful insight. He said, trusted voices, whether they are community leaders, faith leaders, or public figures, have the ability to bridge these divides. By engaging transparently and inviting questions, he believes that we can foster trust and build healthier societies. So grab a cup of coffee or settle in wherever you are, because today's episode we challenge the way we think, or we challenge the way that you think about healthcare, politics, and the power of trust. Let's get into it. Take me through how you've started thinking along this line that this is a subject that we want to study, probably because the news feed gives us an idea that things are really serious and we are moving towards this line. So what was the starting point for you? What made you to be curious and actually studying this?
Sure. So, Jay Van Bovel is the real leader of the study, unfortunately traveling. So I have to credit that he had some engagement with the editor, and obviously in any election, health is going to be central to it. There will always be a matter of whether it's a specific health issue, like in 2020, where it was COVID, or if you go back to 2008, when you talk about marketplace health insurance, there's always going to be a major component of healthcare in any election, right? Rising costs, access, and so on. And that's not just in the US, but anywhere. I mean, countries around the world, healthcare is always going to be, because it's a system of some kind, is going to be inherently political. The thing is that we also know that in recent years, because there's this growth in polarization, when there's a growth in polarization, it means fundamentally topics that are on the election agenda are going to likely have influence in many different directions, right? But as we start seeing people move away from kind of a lot of overlap between groups, and around the world we start seeing movements away from middle, what it means is that we start sharing those polar patterns on topics specifically within health. So rather than, seeing trends where it was kind of, health was always kind of decoupled with actual political views, we're seeing, because of the way they're aligned with those political views, we could start seeing trends in a lot of different things. So the idea for this work was really to track what is known, where can we see certain patterns and so on, right? And what you start getting now, we really did try to cover evidence from around the world, but frankly, it's just being more heavily studied in the US, right? One of the big problems we actually ran into is we kept thinking we had found some non-US studies to include, only to find out the authors were not from the US, but they were using American data. So it says something about a country that, all the data is available that you need, or lots of studies are being done, or there's research being funded to do. So you kind of hyper focus on the States, but the pattern exists in other places to various levels. Okay, maybe not to some of the extremes we're seeing. So then in building out, oh, sorry, go ahead.
No, please continue.
Um,
Continue, please.
yeah, so then in building out the work and looking at it, you start seeing some very clear patterns. And some of the big patterns is the movement away from, I base my health behaviors on guidance, medical practice, my doctor, standard recommendations. Two, first checking where your group affiliation sits. So first I say, what is my group affiliation? And then where do I align it? Now, we need to be careful not to extend where the problem is. It's not everybody, it's not 95% of the population. But what we're seeing is it's moving away from small margins into more the mainstream of different groups, right? And then it starts becoming an issue, right? It's not 90% of any particular group is doing it, but it's large enough margins. And then what that's led to is that we start seeing where there's a rejection of good standing health guidance. We see a reemergence of things that we've dealt with years ago, or we just see higher rates in certain communities, and that puts everybody at risk. So that's essentially the kind of evolution of that study, and how we kind of got to where we ended up.
Yeah, thank you very much. So, talk
Mhm.
me through the findings, and if you can still emphasize on what
Mhm.
stands out, what were you not? Is there anything stand out uniquely in your findings that you were not expecting to find? So, what did you find, and what is unique about the findings?
Sure. So since this is not original, there's no original data in this study. I can only speak to kind of the what we found in terms of the patterns we're seeing. And what the patterns we're seeing are, we are seeing there's rising animosity between groups. So rather than just being strongly associated with mine, I'm strongly against other. Right. That's what we start seeing is it's not just individuals who see themselves as more closely aligned to their group, they see them specifically against the other group, right? So what that does is it entrenches people. And now, if you have a stronger animosity toward the other side, you start not just associating with your group, but actually pushing away from other groups. So, for example, if I love a sports team and I just love my team, I can think great things about all the people on those teams. But if I start having negativity toward the other team, now I don't necessarily even go as strong about liking my team. I just really hate the other team, right? And I want to see that fail and all this, right? And that is a really apt kind of summary of how it goes. Okay. But it's the issue now is we're not talking about sports rivalries. We're talking about when it comes to health, it means the inability to stop infectious disease. It means rising avoidable costs to healthcare, lower mortality rate, lower life expectancies, and higher rates of avoidable mortality, and so on.
This is obviously a truly global problem. But in
Mhm.
insight, do you think the nature of this problem in America is overemphasized because of the fact that it's covered intensely, uh, and is studied intensely, or do you think it's truly a uniquely big problem in America compared to elsewhere?
No, I think like with all of these things, we learn about it in the States first because it's so heavily covered. And in some ways, it becomes a self-perpetuating prophecy where it starts getting talked about and then it gets picked up and then just it kind of rolls. But, we see these patterns emerge in a lot of places, and certainly, the US wasn't the first place that started having divisions about healthcare matters based on ideologies and group affiliations. It's certainly not, been that case. And in fact, quite a few countries had it at more extreme levels before. And we're seeing a lot of this. A lot of it can do with things like religious belief groups, right? And who people listen to. The one interesting thing about it, though, that you raise when people start trying to question whether or not it's a U.S. thing or a global thing, or whatever, is actually this step into what we can do about it, and it actually leads to some hope. And what you start finding is the consistency, the thing that we see around the consistent thing that we see around the world is if you engage trusted voices in dealing with lack of concern, people feeling they dislike something just because it has an affiliation with the other, those trusted voices actually have an impact. People will start turning to who they trust, right? And where those voices of trust lead people to has a major impact. One thing we learned a lot in COVID was, if it was hard sometimes to stay ahead of the curve of some questions and concerns and things that came up. And sometimes those things were so rapid and extreme that it was very hard to be anywhere near them. And sometimes that meant they weren't directly addressed. So one of the things that we start seeing is that if you can at least stay on that and make sure people realize it is absolutely okay to ask questions, to challenge these things, you need to engage with the public voices or the trusted voices who are trying to answer those questions. And agencies and so on need to be more transparent about getting those answers back and saying, keep the questions coming. Never make it seem like I've answered all your questions. Make it seem like you can keep the questions coming. And as we have information, and along with that, there needs to be an introduction of uncertainty. If people are told something is good, they'll interpret that means it always works, right? If somebody gets told a vaccine is good, but then they or someone else they know got vaccinated, but it didn't work, they might interpret that to mean, oh, it doesn't work. But if you introduce things as saying, no one is guaranteed a perfect outcome from anything, right? There's no safe amount of riding in a car, right? There's no safe amount of eating red meat. But the idea is if we can have people understanding that it's not necessarily about an individual person or an individual, moment, but it's that over time, more people are safer from these things by following established guidelines. And that's where it really matters to invite questions and try to provide all the information you can, because then it doesn't seem closed off like people are hiding something.
Yeah, absolutely. And I think is we versus them rhetoric that has really, really strongly polarized the conversation. It's interesting to see how it's playing out in healthcare. And my concern is that when I was reading the article, I said to myself, in even interpreting and accepting the findings of this study, what are your concerns that there could also be polarization in interpreting your own results? Or do you think your own findings is able to sit out of that context of nobody can actually polarize or potentially polarize what we've discovered?
So the issue is there's always going to be people and groups that want to create division. The biggest challenge really becomes getting ahead of that, right? Now, the more attention that's given to that intentional division, the more risk you have. But the more emphasis there's placed on addressing concerns over just division, that's your hope. But I think, when that comes down to it, then it really just becomes a matter of, how visible are, or how loud, I guess, are the voices saying which of those things. That's where the real challenge gets into. So
what are your expectations from these results? What changes, what difference do you think you would like these results to make? Expectations?
I would like to see agencies responsible for establishing health guidelines to engage directly and publicly and actively with trusted voices, community leaders, faith leaders, and so on, in ways that both provide accurate and kind of areas of information that people would learn from, and also in ways that make them feel invited to ask questions. I think that's really one of the biggest ones. My co-authors would have other things to say. That's my angle. I don't want to speak on all of their views, but they will have additional ones. So.